What are the age limits for DTI scanning?
Generally speaking, DTI scanning is for adults, i.e. 18 plus. There are plenty of caveats and exceptions though. Let's look at the older end of the spectrum. At age 60, 65, 70, the brain starts undergoing some chronic degenerative changes. Those are a lot of syllables just to say age-related changes, just like the body does. No matter how fit and healthy, the body does change with age, so does the brain. It shrinks a little, atrophy, some of the fibers start becoming sort of scarred. So the DTI scanning picture on a 75-year-old versus that same individual at 25, even with no abnormalities, will look slightly different. So yes, DTI scanning has value at both ends of the age spectrum, including at the older end of the age spectrum. The picture does change a little bit, but there's no high-end limit, no matter what the patient's age, and I should say, no matter what underlying brain conditions the patient may have. Maybe he had an underlying stroke, maybe he has Parkinson's, Alzheimer's. These do not discount the value of DTI. They might confound the results a little, I will give you that, but they don't discount it entirely. Let's look on the other end of the spectrum, the very young age. We can image younger patients, we've done it before. There are some caveats. When you go really young, the problem isn't the scanning, the problem is the patient won't stay still. As you know, in the MRI, you have to stay still for roughly 30, 40 minutes, and that's very difficult to do when you're talking a child. So that's a caveat there. Slightly older adolescents, the brain's almost adult level, so DTI scanning would have some value. In general, however, DTI is reserved for 18 plus. If you happen to have a patient client who's younger than that, give us a call, we'll talk through it with you, we'll talk to some of our imaging experts, and we'll see if we can accommodate your client.